Sawadee Krap. Hi, I'm Randy with Retire Global Life, and this is the second of two videos on the topic of the real cost of living in Thailand as a foreigner or an expat. In the first video, we talked about the cost of rent and food and transportation. In this video, we'll be talking about the cost of health insurance and visas. Excuse me, but if there's two videos, don't you need two Randys? No, I don't. And stop calling my girlfriend pretending to be me. I'm sorry, dude, but she's adorable. Hey, listen, health insurance is boring. As boring as this guy. But it's vitally important to your health and your finances. So stick around. We're going to cover every single aspect you need to know about getting health insurance in Thailand as a foreigner. And we're going to finish up with talking about our cost of living summary. So stick around. Are you ready? Let's go. Usually I open every video with welcome to Chiang Mai or whatever city I'm at in Thailand, but the fireplace behind me might be a clue. I'm not in Thailand right now. I don't think I've ever seen a fireplace in Thailand. I had to return to California for a little bit, so I'm going to do this video from here. I'm going to divide this video up into several different categories. So in the first one, we're going to talk about the health insurance requirement for each visa. Then we'll look at the cost of healthcare in Thailand and how much coverage you might actually need. And then finally, we're going to go ahead and actually look at some plans online and show you multiple carriers so you can compare all on one website and decide what might be best for you. And we'll give you some pros and cons and some insight regarding the different plans that are available. All right, let's start with the non-OA visa. And remember, please, that right now we're only going to talk about the health insurance requirement for each visa. So the non-OA, it's often called the retirement visa, and it's one of the most popular visas in Thailand for expats and long-term residents. But the confusion starts right away when it tells you the minimum amounts of coverage for inpatient and outpatient care. The figures you're often going to see online are 400,000 baht for inpatient care and 40,000 baht as a minimum for outpatient care. You're going to see this on the website for the TGIA, that's the Thai General Insurance Association, and almost every Thai embassy around the world links to that site to give you more information on health insurance requirements. But those figures are wrong. Well, I should say they're outdated. The new requirements are 100,000 US dollars as the minimum for inpatient care and 45,000 baht for outpatient care. What you can see, which was kind of interesting in that slide, is that the Thai government actually lists the minimum health requirement of $100,000 in US dollars. That's not me converting it from baht to dollars for your convenience. It's actually around the world listed in US dollars, which is kind of odd. But one thing causing some confusion is that some Thai embassies around the world will say the minimum requirement is $100,000 US or 3 million baht. But the math is a little bit off there because for years, the baht's been between 33 and 37 per US dollar. Right now it's around 35. That would mean that 100,000 US dollars would be 3.5 million baht. If we just go with the 3 million baht figure, that's only 86,000 US dollars, and that falls short of the listed requirement. So I think the safe thing to do is make sure you get a policy of either 3.5 or even preferably 4 million baht. In fact, most of the Thai insurance companies that have specific plans meeting this requirement, like the AXA Easy Visa plan, have those in 4 million baht amounts. There's a specific list of Thai-approved insurers that you have to use. And I think since this official list was made, a few more have been added to it. We'll be looking at some of those policies later. But one nice thing about the non-OA visa is you don't have to use one of these listed insurers as you normally do for other visas. There's a specific form that you can use, and it can be hard to find this form, so I'll leave a link to it in my description. And with that form, if your insurance company completes it, establishing that you meet the insurance minimums and that they cover you in Thailand, they'll accept that in lieu of a Thai policy. Let's move on to the non-OX visa. Thankfully, we can kind of breeze through the rest of these visa types because they're very similar to the non-OA. The non-OX, it's called the 10-year visa, has the exact same health insurance requirements, which is 100,000 US for inpatient, 45,000 baht for outpatient. The only difference between the non-OA and the non-OX is the non-OX does not allow you to use the letter by a foreign company showing that you'll be covered. You have to use one of the Thai-approved companies. The long-term resident visa, or LTR, has pretty similar requirements, but they're pretty much cut in half. The LTR has a minimum insurance requirement for inpatient care of 50,000 US and 40,000 baht for outpatient care, and it must be from a Thai-listed insurer. This is another very popular retirement visa like the non-OA. The difference is the non-O option has no health insurance requirement at all, but I know from experience in talking to people around the world, sometimes their home country embassy, or at least the Thai embassy in their home country, will apply the insurance requirement and the same figures we talked about for the non-OA, the 100,000 and the 45 baht. So be prepared that that might be a possibility. Now let's look at the actual cost of medical care in Thailand. Because you might be thinking, hey, you're talking about these insurance plans of 4 million baht, that's $112,000 US. And I can't really speak regarding the cost of medical care in other Western countries, but in the United States, the cost of medical care is outrageously high. And you might be thinking $112,000 is not going to cover a single hospitalization for a major medical occurrence, then you would be right. But luckily, the cost of medical care in Thailand is much, much lower. So let's look at some actual procedures and what they cost in Thailand versus the United States. Let's talk about a total hip replacement. In Thailand, the average cost will be about $12,000 US, compared to the United States, where the average cost will be about $40,000. How about heart bypass? The average cost in Thailand will be about $15,000 US, as compared to the United States, where it will be an average of $170,000 US. These are averages. You can choose different hospitals, and they're all going to vary. Just like in the United States, it's the same thing in Thailand. But all the figures that I'm giving you are for private hospitals in Thailand. Government hospitals will cost you, on average, even less. For outpatient care, in other words, just going for a regular doctor appointment, the average fee in Thailand will be between $15 and $45 US. The higher end tends to be for a specialist. And in the United States, it's going to be between $150 and $450 US. So you can see based upon this that $112,000 US is actually a lot of coverage. And I'm not saying you can't get more, but even the basic minimum is substantial coverage. Let's go ahead and check out some actual plans online. And for that, let's go ahead and get on my computer. We're going to go to the mrprakan.com website. If that sounds like an odd name, it's really not. Prakan is the word in Thai for insurance, so it's like saying Mr. Insurance. I like this website because I compared many, many sites. This was the best one by far in terms of giving clear, detailed information regarding many different insurance companies. They're basically a comparison site, a brokerage, kind of like the Amazon of health insurance companies. So let's go ahead and go online and check out some of these sites. So you'll see when we start off, it's in Thai. Go to the globe, drop down to international, then over to English, and now we have it in English. Unfortunately, that's not really going to help because those top 4 boxes that all deal with health insurance in Thailand, what we want is just too specific for their general Thai audience. So I work with the Mr. Ragan team and we created some specific pages. So now there's a specific link for each type of visa that you're looking for with plans that will meet that requirement, or if you're just looking for general good health insurance as a foreigner or an expat. So you can find that link in the description. Okay, here we go. I love the fact that they don't ask my date of birth, my address, my country of origin, all that stuff that everybody else asks for. All they ask for is gender, age, and email. I'm going to put in 65. I've already filled in my email address here. And here we go. They've laid these out in a very, very easy to read format. I think there's about 15 policies on this page. Let's just look at a couple that I think might be of specific interest to you, and I want to point out some pros and cons and some cautions that you might not be aware of otherwise. Let's start with this one on the top left. This is AXA Easy Care, and this is a specific plan. It's super cheap. So starting at the top, you can see that it's a little over 21,000 baht. That equates to about $619 per year US, or $52 a month. If you've ever bought insurance in the United States, you know how absurdly cheap that is, so don't have your expectations on coverage too high here. But the big concern here is the deductible. As you can see, is 300,000 baht, which is roughly $8,500. That's a big chunk of money to come up with before you can even start getting coverage. The next concern is the outpatient care, and you can see the coverage states it's 1,500 baht per visit, which is actually fantastic. The problem is it really doesn't exist because the 300,000 baht deductible not only applies to inpatient care, but also to outpatient care, which is kind of ridiculous that it's listed there, but it's just the reality of the policy. So I only know this because Mr. Pragan's team, who I found extremely forthright, pointed that out to me. The other thing I wanted to mention was if you drop down, you'll see that a checkup is required. And every insurer is going to have a different policy. Right now we're looking at AXA, and their policy is that a checkup is required if you're 61 years of age or over. LMG, another major insurer, does not require a physical at all, ever. Pacific Cross, and we'll be looking at their plans in a moment, requires a physical when you are 65 years of age and over. So bear in mind, all insurers are going to require a health history from you. It's just that some, in addition, require a visit to a doctor. You can apply for an AXA policy up until the age of 80. After 80, you cannot apply, but if you have a policy prior to 80, you can keep your policy up until age 99. If you move to the right and you see the policy of LMG, they have pretty much the same policy in terms of 80 being the maximum age and insuring you until you're 99. But in looking at the LMG plans as compared to AXA and Pacific Cross, I think you'll find that the LMG plans cost more without providing more of a benefit, so we're not going to be looking at those in any detail. I actually wouldn't recommend either of those two plans I just mentioned. A lot of people refer to those plans as almost throwaway plans, and what they mean by that is they're getting health insurance just to meet the visa requirement, and either they plan to carry no insurance and just self-insure themselves because they have enough assets in case of an emergency, or they're willing to take a big chance, or they're going to get another health policy that offers better coverage, but maybe the company they plan to get that more complete insurance policy from is not on the approved list meeting the requirements for the visa. So let's see if we can find a good plan that will satisfy the visa requirements as well as giving you good health insurance at a good cost. So let's drop down to another AXA plan. The difference is that this plan, although identical to the AXA plan we just talked about, offers a deductible of 100,000 baht instead of 300,000 baht. That means the deductible is basically $2,800 US. Now the plan is a little bit more. It's 31,000 baht and change, which is a little under $900 US or $74 a month. But the out-of-pocket in case you have a medical need is much less. Another thing I'd like to point out in the negative category about these policies, because I want to be as forthright with you as I can, is that these deductibles, whether it's the 100,000 plan here or the 300,000 one we just talked about, is not per year, it's per incident. So in other words, if I have one major medical occurrence in January and I have another one in April, that deductible amount restarts for every occurrence. So let's talk about two more policies, and these offer what I think most people would consider real health insurance. This next one is by Pacific Cross. It's the Maxima plan. And you'll see quite a few differences to the policies that we just talked about. For one thing, it costs significantly more. The premium is basically 70,000 baht per year. But what are the big benefits here? One is the policies we looked at before only covered Thailand. So if you had to leave the country for a vacation or something, you'd have to buy travel insurance to cover you for that period. Notice that with Pacific Cross, it's worldwide coverage, excluding the USA. But it would cover you if you split your time between Thailand and the Philippines or Vietnam, wherever it might be, even Europe. The maximum coverage is also bumped up from 4 million to 5, but the big difference is right below that, where you can see that the deductible is 0. In other words, you have no cash out of pocket at all for your medical care inpatient at a hospital. Now, each provider, including Pacific Cross, has their own list of preferred hospitals. So if you go to one of those hospitals and you're clearly there for a covered area, then you don't pay a dime. They just bill Pacific Cross directly. And I've looked at the list of hospitals for Pacific Cross, and all the major private hospitals are there. It's not like they list only low-cost hospitals. All the very good ones I was familiar with were listed. I'm going to interrupt myself for a brief second here. I hope you're enjoying this video, and if you're finding it helpful, I really hope that you'll take a moment and give it a like, subscribe to my channel, and ring the notification bell so you're informed about new videos. And please leave a comment. I'd love to know your interest in Thailand and any questions you might have regarding health insurance or the cost of living in Thailand. All right, back to the video. But this plan at the price we just saw does not include any outpatient coverage. If you want to include that, you'll click right here, select full cover, and now it shows that the price has gone up to 87,000 baht, which is roughly $2,500 a year or a little over $200 per month. So just like the inpatient, if you select the full cover option, everything is covered with no deductible. You can also select dental and vision and see what that adds to your premium. Now, I'm not going to go through everything that's listed, but what you'll want to do is click here at the bottom on all these policies and click View Coverage. That brings us to a brochure from the insurance company itself, giving us much more detailed information regarding each insurance policy. The last plan I'm going to talk about is also from Pacific Cross. It's the Ultima plan. And this offers 20 million baht in coverage, so 4 to 5 times the policies that we just looked at. And it's also can be a very complete coverage. I'm going to just click right away on the outpatient and bring that up to full cover so we can see where that would bring us. So for 111,000 baht, that comes out to $3,184 per year or $265 a month. This plan has no deductible for inpatient or outpatient care. It comes automatically with dental and vision, as well as emergency assistance, which is basically relocating you to an area to get care if you need assistance with that. And when you think you found the right plan for you, you can click Apply right here and then complete the very annoying questionnaire with all those questions that, of course, insurance companies have to ask regarding your height and your weight and any medical conditions and things that you've had in the past. What I would strongly recommend before you do that is you talk to one of the people on the Mr. Prakan team. I found them extremely helpful and extremely forthright. They were the ones that pointed out those things to me that I mentioned on the AXA plan. So I was very grateful for that honesty. And you also want to ask questions regarding things like what companies have a reputation for perhaps raising rates, or what companies are more likely to drop someone at the end of a year because they had excessive claims. So those are very important things for you to know. So I hope that information was helpful, actually looking at policies and seeing exactly how many options you have, and that you can actually get a new policy as old as the age of 80 and keep these plans until you're 99. Now, the Mr. Prakan site may not be for everybody. It's an ideal site if you're out of the United States and you're looking for health insurance, or you just like the convenience of doing it online from within Thailand. But if you're in Thailand, you can find an insurance broker or agent that you think is right for you. The Mr. Prakan site doesn't have every insurance company. One of the companies that I like is called AIA. They're kind of the State Farm or Allstate of Thailand. And they've got a plan called Happy Health. I'll go ahead and put the rates online by age. But their plan's very nice for a 5 million baht plan. The rates are pretty reasonable. And one of the really nice benefits of their plan is they have 44 listed serious illnesses where they double the coverage. So it goes from 5 million baht, which is the coverage you're paying for, up to 10 million baht. And on the list of things you'll see, I'll put this online as well, you'll see a stroke, heart disease, various cancers, multiple sclerosis, Parkinson's. So it's another option that you have and might want to consider. I don't think any plan is perfect. Here are some pros and cons that I see on the Health Happy plan. All right, let's move on to the second part of this video, which is part 2 of our Cost of Living in Thailand series. Okay, we're ready for part 2 of this video, and it's also the second in a series on the cost of living in Thailand. And by the way, for those of you that might be new to my channel, I'm kind of a 50-50 expat. I divide my time between Thailand and my home here in San Diego. I go back and forth every 2 months. I haven't quite pulled the trigger on full-time retirement because I love my life here in California, but I actually love my life, especially my girlfriend Joy, in Thailand even more. So I'm really excited. I'm leaving for Thailand in just a couple days. So let's pick up our video regarding those 5 main themes on the cost of living in Thailand. And I thought I would do it in my backyard here, and I'll give you a little tour. In the first video in this series, we literally took you with us to 4 different apartments. We saw one studio as cheap as $97 a month. We visited a couple apartments in the middle range from the $300 to $400 range. And then last, we saw a new luxury high-rise condominium that was $720. We also took you with us to more than a dozen restaurants so you could literally see what the food looks like and exactly how much it costs. And then last, we talked about transportation. We focused mainly on motorcycles, but we also touched upon other affordable ways to travel like songtaos and grabs. And in this video, we're closing it out discussing the cost of health insurance and visas. So let's talk actual numbers, but first I have to pick a lemon. All right, now I've got my lemon for my morning lemon water. In the first video, we talked about apartments exclusively, but if you're thinking about renting a house, a freestanding house, those are certainly available as well. In fact, they don't even really cost more. The difference is that if you're renting an apartment, you can be central. If you want to rent a house, you're always going to be outside of town, and maybe that's what you want. But I would say the average price for a nice house is between $400 and $800. So very easy to find an actual house to rent. But what about utilities? Because that's a real cost that you have to factor in. Water in Thailand is basically nothing. I would say the average water bill in Thailand is maybe $8 a month. But electricity is another matter. That can actually get much higher depending on how much you use your air conditioner. These are some really nice Concord grapes that are going to be ripe in maybe about a month. I'll be in Thailand, so it looks like my neighbors are going to eat them. So if you don't use an air conditioner, your electricity bill is probably going to be only $10 a month. But if you do use your air conditioner, and you will because Thailand is not exactly a cold country, that's going to be what really determines the cost of your electricity bill. Thailand is not like the United States where we have central air conditioning and you cool your entire house at the same time. They've got a more sensible system, which basically has a wall unit for most individual rooms. So you just cool the room that you're in. So if you rent, let's say, a studio or a 1-bedroom, and you have just one unit going, and I'm going to say, let's say, 8 hours a day, maybe even 10 hours a day, I would guess your electricity bill would probably be around $50 a month. But if you've got a 3-bedroom house and you've got all air conditioners going, then of course your cost is going to be going up. And you can get fast Wi-Fi for $10 to $20 a month. So with those things in mind, let's take another look at our housing budget. And if you're a couple, then you can basically divide the rent cost in half if you're doing your calculations on a per person basis. One other thing to be aware of if you're planning on moving to Chiang Mai or anywhere in northern Thailand like I live is something called the burning season, or sometimes people call it the smoky season. And that's usually around February and March. Those are the worst months, but it can be sooner or later. And what happens is the farmers, not just in northern Thailand, but mainly in Laos and Myanmar, start burning their crops at that time of year. It's a way to regenerate the soil. And it generates a lot of smoke, and that settles into valleys like Chiang Mai. And it actually becomes quite unpleasant. Some years are worse than others. In 2023, it was horrendous, to be quite honest. Years before that, it wasn't quite so bad. So this can affect your housing budget, because if you're leaving like some expats do, then you're paying additional rent for those months that you're in another location, assuming that you're on a one-year lease here, where you're going to be leaving your unit unoccupied. For many people, this is not as inconvenient as it sounds to leave every year. It's just when they plan their vacation, whether it's to return to their home country or to explore other parts of Thailand. Most people go to one of the beach cities or one of the islands. Figuring food costs is a lot harder because it's quite subjective how much we eat and what kind of food we want to buy and what kind of restaurants we want to go to. But I did my best to divide it up into 3 different categories. So at the low end budget here, this is going out once or twice a day, but it's getting basic Thai meals, your standard 50 baht pad grapao or pad Thai, meals like that, and then also making some meals at home. It doesn't really include extra things like going to a coffee bar or getting a smoothie. In the middle range, this also is going out once or twice a day to eat, but it's a higher range of restaurants. So it's not just your 50 baht Thai places, but mixing in some Western meals and also getting a coffee every day or maybe a smoothie. At the high end, we're still going out to eat once or twice every day, but we've got a much bigger selection of restaurants, nicer places, a lot of Western food. When we go and make food at home, we're probably buying much higher quality organic food. And we can go get a coffee once a day, twice a day, mix in a smoothie. We pretty much have a very flexible budget. Now, this budget is per person. So if you're a couple, you'd have to double the numbers that we're talking about. And I didn't include alcohol. That can completely change your budget if you like to drink alcohol. For example, you can go get a cheap bowl of pad Thai for 50 baht, but if you get 3 beers at the same meal, you just basically quadrupled your meal price. So that's something you're going to have to factor in as well. In the last video, when we talked about transportation, we really focused on motorcycles because, let's face it, that's the main way to get around Thailand, and it's certainly very, very affordable. And we talked about other alternative transportations like Song Taos and their version of Uber, either a Grab or a Bolt. But we didn't really talk about cars. So if you want to rent a car, it's quite a bit more expensive. I would say the average car rental starts around $500 a month. But if you're going to get a car, most likely you're probably going to buy one. And one thing about used cars in Thailand, they actually keep their value quite well. So unlike other things that are super cheap in Thailand, that's actually not true regarding used cars. I would say what you should do is go on Facebook Marketplace, plug in the city that you're thinking of living in, and just start checking out used car prices. On average, I would say that a car that's roughly 6 years old is going to cost you $10,000 to $12,000 in that approximate range. If you rent a car, insurance is usually included, which when you rent a motorcycle, it's not automatically included. But if you're going to be buying a car or a motorcycle, then you definitely need to look into insurance. In fact, it's mandatory that you have insurance in Thailand. But the insurance system there is a little bit complicated. Let me go over some basic fees of what insurance costs in Thailand. The minimum mandatory insurance that everybody has to have, and you have to show proof of insurance every year when you register your car, is only 645 baht a year. That's only $18 annually. So it's obviously not very much coverage. So if you get more insurance, like most people will want, it's completely different than buying it in the West, where we individually buy certain things like I want liability, I want collision, I want comprehensive. Here it's divided up into 5 different levels or categories or classes. They've got class 1, class 2, they've got 2 plus, and they've got 3 and 3 plus, so 5 different levels. I'll put up a chart for you regarding the basic cost and a rough idea of the coverage for each of those levels. I'll divide it up into just the 3. I won't include the 2 plus and the 3 plus, but this will give you a rough idea of what kind of insurance will cost you in Thailand. And if you're wondering why these costs are so cheap compared to Western countries, it's a few reasons. One is the cost of repairing a car in Thailand is actually much less expensive for things like body work and repainting than it is in the United States and other Western countries. And also medical care, as we've talked about, is much less expensive than other countries. And liability is also less in terms of compensating somebody for an injury. We just talked about health insurance in great detail. Now, you may decide to get no insurance at all, so your cost would be zero. But the $70 you see here for the low and medium range is assuming that you bought that first policy that I showed you, which is the least expensive one that I know of, which is the AXA Easy Care Visa plan that was roughly 21,000 baht a year. I've added on to that monthly amount with the $70 here. That includes 2 doctor visits a year as an outpatient at about 1,000 baht each, as well as 2 dental cleanings a year. By the way, dentists are incredibly inexpensive in Thailand, and it's very easy to find a good English-speaking dentist. For an extra $24 a month, you could get the better plan that I showed you, which is the 100,000 baht deductible plan. The figure that you see for the high level would be if you bought a plan like the AIA policy that I showed you. And I've also added on to that the 2 doctor visits a year and the 2 dental visits a year. As far as visas go, we can really summarize this pretty quickly. Other than the elite visa, which is extremely expensive, all the popular visas pretty much cost the same thing. That's about $200 a year. I've added on for some incidentals to come up with the monthly amount that you see here. That's doing it yourself. For the high budget, this includes paying either a visa agent or attorney to do it for you. Let's go ahead and add up all these categories and see what our totals are at the low, medium, and high levels. Now, you might look at the low end and say, that's not possible, that's too low. But you saw with your own eyes that it is possible. Rooms like that are available. That includes going out to eat. It's just a very, very Spartan lifestyle. I think realistically, that's not a life that anybody would want to maintain, but that gives you an idea, at least at the bare bones, most simple life possible in Thailand. Now, at the high end, you might have the exact opposite thought, that that's more than you thought it would be. But remember, that's a really nice place to live. It includes health insurance and medical. It includes going out to nice restaurants once, even twice a day, and all the coffees that you want. Ask yourself, are you going to be able to get those things in your home country at that same price? All right, we have finished our 5 categories of living costs, and there is nobody happier about that than me, because this video has been a lot of work. But I told you I had one additional category I wanted to talk about, and that's kind of incidental costs and social costs, just going out and having fun, because that's an important part of life. And we didn't talk about cell phones. Cell phone coverage is really affordable in Thailand for cell coverage and internet. Usually about $15 a month is good coverage. $20 a month is great coverage. But what about social costs, just going out and living life? For some people, that's really affordable. A lot of people, their fun activities are going for hikes, going jogging, going for walks, exploring the city, inviting friends over for board games and watching movies online. Well, that's great. If you're someone like that, you really don't have any extra things to add to your budget. But a lot of people do. Some people have a very active social life. What about travel, for example? One of the nice things about living in Thailand is it's so close to all those other countries in Southeast Asia. So you might want to be taking trips to Japan and the Philippines and Vietnam and so on. So that's an added expense. If you like sports and activities, I did a video recently called Starting a New Life in Chiang Mai. And I showed you a resort where you can go, and for just $30 a month, you can visit the gym and use the big pool and all the facilities there, the sauna and everything. So it's basically $1 a day. And I also showed you a sports club where you can play golf and tennis and other activities like that. And so those are 2 activities right there where you can just add $30 a month to your budget and be really active. But there's a lot of guys that are going to want to do other things. Like what about bar girls? Thailand is kind of famous for that. That's not my area. I've never been interested in that, so I can't really advise you, but that's certainly going to be adding to your budget. So the last bit of advice I would give is when you're thinking about coming to Thailand and making this budget, remember the reason why you're coming to Thailand. It's to improve the quality of your life. So if you make your budget too tight and you really don't have any extra expenses, you're not going to have the quality of life that you want to have here. I enjoyed talking to you. I hope this has been helpful. And until I see you again, safe travels.
Side by side, our fears are done. All the good times.